Hi, my name is Caleb Perkins. I'm going to be doing my IV start and my primary infusion video. So the first thing I do is 2 patient identifiers, allergies, 11 routes, and 3 checks of medication administration. And then I'd wash my hands. I'd start off by grabbing my IV bag right here, and then I would grab my primary tubing, making sure to maintain aseptic technique throughout the entire video. Here we go. I would remove this cap first, then I would remove this one, disposing of them properly. Then I would spike my bag without touching the sides, maintaining aseptic technique. Then I would hang my IV bag. I would take my cap off to prime my solution. Roll that down. Now that I see there is fluid coming out, I can put my cap back on. Then I will hang my tubing. Then now that I've hung my tubing, I'll grab my sterile saline and I will start my J-loop flush. So I would grab my J-loop, then I would attach it to the saline, and prime it. My J-loop is now primed. I can set that back in the package. Now, palpate for a vein. Palpate for a vein. Then I will grab my tourniquet. I'll apply my tourniquet 3 to 4 inches above the insertion site. There we go. There we go. Now that my tourniquet is applied, check for radial pulse. And then I would wash my hands, apply my gloves. I would take my cleaning thing I have here, or per facility standard, clean the insertion site, dispose of that properly. I grab my needle and IV catheter kit, take the top off like this. Then 10 to 15 degrees, I will insert my IV. Once I see blood return, I can advance my catheter off and go ahead and pop my tourniquet. Advance my catheter off, pop my needle safety, holding my IV port the entire time. I would then screw it on. I'd aspirate for blood return, and then I would flush my IV port. I would not have taken that side off. I would have taken the blue side off of my sterile saline. Set this up right here. Go ahead and hold this the entire time. I would then grab my tape and properly secure my IV insertion site, not touching the site the entire time. I grab my transparent dressing, put that on, and then I will grab my alcohol pad. I'll scrub my hub for at least 30 seconds, maintaining aseptic technique. And then I will grab my primary tubing, take my top off, and then hook that up to my IV, unclamp my tubing. There we are. Then I would set the flow rate as prescribed, as whatever kind of medication it is. Set my flow rate. The entire time I was doing this skill, I was checking for infiltration or any signs of complications with my IV site. And then, let's see, I would also make sure to label my IV site, the date, the size of the needle, and the nurse. I would put that probably taped on there with the transparent dressing in or around the area, but not over the insertion site. And then I would take off my gloves. I would wash my hands. I would document the patient. I would document that I put an IV in them. Document how they reacted to the medication in this IV bag right here. And then I would report and record.